I would like to thank the ICS for the opportunity to present our work. 4-year outcomes of the adjustable Transobturator Male System, A.M.I, for stress urinary incontinence, the first UK review. Stress urinary incontinence is a devastating complication after radical prostatectomy. Management consists largely of either pelvic floor physiotherapy or surgical intervention. The original suburethral slings cannot be easily adjusted after insertion. Artificial urinary sphincters require good patient dexterity and cognitive function, and additionally the surgery is more invasive. Adjustable Transobturator Male System, A.M.I, is an adjustable sub-urethral device consisting of a balloon mechanism inflated via a buried port-catheter. This port-catheter allows for insufflation alterations to the balloon in an outpatient setting without requiring anaesthesia. We present the first UK experience of using A.M.I in treating men with stress urinary incontinence. Men with stress urinary incontinence who were undergoing A.M.I insertion between 2015 and 2019 were recruited. Stress urinary incontinence was confirmed by a 5-day bladder diary and correlation with clinical symptoms. Urodynamics were performed in patients whose bladder diaries or symptoms suggested of overactive bladder or mixed urinary incontinence. These patients were excluded from the study. Post-surgical responses were reviewed in a specialist consultant clinic where adjustments were made to the balloon volumes as required. Dryness was defined as using a maximum of 1 pad a day for reassurance only. 70 men were recruited, with an average age of 70.3 and a range of 50 to 81 years, and underwent insertion of A.M.I for post-surgical stress urinary incontinence. Of these, 66 men, or 94%, had stress urinary incontinence secondary to a radical prostatectomy. 11, or 16%, had previously had a conventional sling, and 14, or 20%, had previously had urethral bulking agents. The average follow-up was 4 years, and this ranged from 2 to 6. 54 of the 70 men achieved dryness with A.M.I insertion. Dryness was achieved within 6 months for 34 of the 54 men. This was 63%. This ranged from 1 to 24 months. The average pad use was 3.3 pre-operative and 0.7 post-operative. Of the men that did not achieve dryness, 7 of the 14, or 50%, had previously undergone radiotherapy. The average pain score at 3 weeks post-operative was 2.5 out of 10. This decreased to 0.5 out of 10 by 8 weeks. There were 11 complications, or 16%. 2 cases of urinary retention, 2 cases of mild perineal pain, 2 cases of mild scrotal pain, 1 case of balloon mechanism eroding through requiring reimplantation, 1 case of balloon mechanism requiring reposition, 1 case of superficial wound infection treated medically, and 2 cases of an infected device requiring removal. Figure 1 shows the pre- and post-operative incontinence. The A.M.I is an efficacious treatment for men with stress urinary incontinence. The time to achieve dryness reflects the post-operative incremental adjustments to balloon volume. The effectiveness of the A.M.I appears to be hindered by previous radiotherapy. The A.M.I device has low complication rates with only 2 cases requiring removal. In conclusion, the A.M.I device has high success rates in men with stress urinary incontinence post-prostatectomy. From our studies to date, the A.M.I seems to be less effective in men that have previously received radiotherapy. Further review on A.M.I with larger numbers of patients and longer follow-ups are required, in particular establishing randomized controlled trials in order to confirm these positive outcomes as well as ascertain its long-term safety profile. Thank you.